Hi, I'm Thea. I'm the urology nurse at North Eastern Urology. Today I'm going to give you more information on robotic radical prostatectomy. In with your paperwork, you would have received your hospital admission details, your fasting times, and a pathology request form. Please take the pathology request form and have all your tests completed 1 week before your surgery. The first thing we need to establish is whether you have any health issues. For example, if you're a diabetic, if you are on any blood thinners, or if you take any special vitamins such as fish oil. This is the prostate. The prostate has nothing to do with testosterone. It does not control continence, and it does not have any effect on erectile function. Together with the seminal vesicles, which are these here, it produces the fluid in the ejaculate. Now we're going to have a look at the anatomy and how it looks inside your body. The kidneys are up here. The kidneys have a ureter each that drain urine into the bladder. Once the bladder reaches a certain level, the bladder contracts and expels urine through the bladder and through the prostate, and then out through the penis and to the exterior. This is your bladder, your prostate, and your external sphincter muscle is this muscle here. This is the muscle that keeps you dry. When your bladder contracts, it expels the urine, and the urine flows through the prostate and out to the exterior. In robotic radical prostatectomy, there are 6 port sites or incision. 1 is used for the camera, 4 for the arms, and 1 for the assistant. At the end of the operation, the prostate is removed from one of the port sites. So during surgery, the prostate is cut here between the bladder and the prostate, and here at the external sphincter muscle. The nerves are peeled back. The prostate and seminal vesicles are removed. The bladder is then moved down to the external sphincter muscle and is reattached. The reattachment of the bladder to the external sphincter is done with a catheter in place. This is what a catheter looks like, and it's inserted before surgery commences. It's inserted in through the penis and into the bladder, and it's held in place with water inflated into the balloon. And this is how it sits at the base of the bladder. This is the catheter. The catheter is inserted. It goes in through the penis, through the prostate, into the bladder, and we used water to inflate the balloon. This is how the balloon will sit at the base of your bladder. Now we're going to demonstrate how the catheter is anchored to your thigh and how to look after your catheter. The catheter will sit on your thigh at approximately this level. You'll be given a catheter strap, this strap here, that will sit firmly on your upper thigh. This loop here will loop around the wide junction of the catheter. It's this junction here, and will help support the catheter and stop it from moving. Whilst you're in hospital, you'll have a bigger bag like this that will drain the urine continuously. Before you go home, the nursing staff will come to see you, and they'll instruct you how to look after your leg bag. The leg bag that will be inserted, will be attached, will be this one here. To attach this, it's quite simple. You just remove this here and then attach the leg bag. To anchor this correctly to your thigh, you'll be given a leggy fix like this. This leggy fix you wear like a stocking. The catheter leg bag will sit here, and this will then go around. To empty your leg bag, it's quite simple. you just flip this down. That will empty your leg bag. Give it a bit of a tap, dry it with some toilet paper and close it off again. Your job is to empty out your bag every 2 to 3 hours during the day. You do that for several reasons. Firstly, it's forcing you to walk to the toilet. You're exercising. Secondly, you're keeping an eye on the colour of the urine. It should be a lovely pale colour. We do expect it to be bloodstained for the first few days. But if it's dark, it may mean that you're not drinking enough. So increase your fluids. To let you get some sleep overnight, you'll be given an overnight bag like this that attaches to the end of the leg bag. It piggybacks like that, and then all you need to do is open this up, and that will allow the urine to be drained overnight and let you get some sleep. Wake up in the morning, close this off, disconnect your overnight bag. This is taken off to the toilet. You empty this, just slide the tap across, that will empty it, and then you slide it back, squirt some liquid detergent, whatever it is you've got to wash your dishes with some warm water. Give it a good wash, rinse it through, and then hang it up in your bathroom like that and let it dry and reuse again that night. You'll be given the leg bag that's placed, plus an extra leg bag to change 5 to 7 days once you go home. Once you change your leg bag, you will also need to change your overnight bag. Both can be discarded in the bin. Continence aids come in a variety of ways from level 1 to 4, where level 1 is at least absorbent and level 4 is the most. There are also further limited pad aids referred to as continence shields when leakage is minimal. We encourage you to purchase 2 boxes of level 2 pads in your size prior to the operation so as to be prepared for possible leakages when arriving home. We must now discuss the general risks of surgery, which all individuals are faced with when choosing to undergo a major operation. Anaesthetic. There is always a small possibility of drug allergies and difficulty with breathing tube replacement when undergoing a general anaesthetic. This can be discussed with your anaesthetist further if you have any concerns. Infection. There is always the possibility of getting an infection when normal body barrier function is impaired by an operation. Infections may occur in the wound, your lungs, at IV drip sites or in the bladder. Antibiotics are given at the beginning of your operation and in some cases following to minimise this risk. Bleeding. As with any time in an operation, there is a risk of bleeding, possibly requiring blood transfusion. This risk is low. Heart attack or stroke. Depending on your own risk factors such as obesity, high blood pressure, high cholesterol, previous stroke or heart attack, and irregular heartbeat, this operation may put you at a high risk of complications. We note the risk is low, often below 0.5%, but further discussion with your anaesthetist and surgeon may be required. Clots. Deep vein thrombosis or DVT in your legs and pulmonary embolism or PE can occur in 1 to 3% of people who undergo major surgery depending on their individual risk factors. Steps taken to minimise the risk of these potentially fatal complications are early mobilisation, the use of compression stockings, sequential compressors, and the use of Clexane, a chemical blood thinner. There are several specific risks and side effects of prostatectomy that warrant further discussion. Generally speaking, immediately following your operation, all men will be incontinent, will have lost their erections, and will have a degree of penile shortening. This is most often temporary, and commencement of pelvic floor exercises and initiation of erectile aids as soon as the catheter is removed may improve this. We note erectile dysfunction risk is unique to the individual. If you have poor erections prior to the surgery, do not expect them to improve beyond your current state, and you may be more likely to have further long-term impairment following the operation. At 6 weeks following your operation, roughly 50% of patients are dry. 70 to 75% of patients are dry at 6 months and 90% of patients in 1 year. 5 to 8% of patients may require ongoing continence pad use for security purposes, and 1 to 2% may choose to have further intervention to aid with continence, which may be discussed with your surgeon at any time if you have any concerns. At any point in the operation, there is a risk of damage to other structures in the area of the operative field. In 1 to 500 cases, damage to the bladder or bowel may occur, which is repaired at the time of the operation. If this occurs and there is concern about long-term effects, you will be informed when you wake up, and the surgeon may outline a path of further management, but rest assured this is very unlikely to transpire. Following reattachment of the bladder to the urethra, there is low possibility of what is called a urine leak. Most often this issue self-resolves by keeping the catheter 1 to 2 weeks longer than initially planned. Where there is a leak, rarely a pelvic collection of fluid may form, which may require radiological placement of a drain tube or even more rarely revision of surgery. Further very low risk complications may be a bend in the erect penis or scarring at the joint between the bladder and the urethra, limiting urine flow and requiring further procedures. Following leaving the hospital, your surgeon will make contact with you within the first 10 days to inform you of your histological outcome. That means what the cancer grade and type was under the microscope. Your trial of void, also known as removal of the catheter, will happen between 7 to 14 days following the operation, unless specific circumstances to your case require it to be left longer. Starting pelvic floor exercises and, if appropriate for you, medication to rehabilitate erections should be initiated following removal of catheter. The next time you interact with your surgeon will be around 6 weeks following your operation to review a PSA test done at the time to assess for cancer control, discuss erections, continence status and any concerns you may have. You will then be seen on a 3 to 6 monthly schedule for a minimum of 3 to 5 years depending on your individual situation. If on leaving the hospital you develop fevers, increasing pain not controlled by pain medication, increasing redness or warmth at a wound site, or are persistently passing blood in your catheter, please contact Northeastern Urology offices to let us know as further management changes may be required. I am looking forward to meeting you in the rooms, and remember, we are here to answer all your questions and help in any way we can.